Good afternoon, everyone. I'm Stephanie Hayek, the Operations Manager of AFNOR Middle East, and I'm going to be the moderator of this webinar. First of all, let me tell you that I'm so glad to see that so many people are interested in our webinar. And I can see that you're coming from the different countries of the Middle East. So welcome, everyone. So I want to tell you that this webinar is the fruitful collaboration of two entities, AFNOR Middle East and Hospitality News. And now I'm going to start showing two slides related to Hospitality News to give you an idea about this group. And now I'm going to present AFNOR Middle East. So AFNOR Middle East is the subsidiary of AFNOR Group, which is a multinational. The activities of AFNOR are subdivided into four categories: the standardization, the certification, the training, and the industry press. When we talk about standardization, we mean that AFNOR is the Association Française de Normalisation. It is the French normalization body that works closely with the ISO organization based in Geneva for the elaboration of the new ISO standards, for the review of the existing ones so that they become more adapted to the evolution of the market, and to the distribution of the standards within France. When we talk about the certification, we mean that AFNOR is a certification body performing audits according to the different ISO standards. The most common ISO standards are the ISO 9001, the Quality Management System and the Organization, the ISO 14001 related to the environment, the new ISO 45001 related to the occupational health and safety at work, the ISO 22000 and the FSSC, and I think you're most familiar with these two standards. It is related to the food safety management system, and the two new topics, the ISO 50001 related to the energy and the ISO 27001 related to the security of data. AFNOR is also a training body performing the IRCA trainings according to the different standards. The IRCA trainings are the international trainings related to auditing. We also organize internal audit and awareness to standard trainings. Industry press, we have something called AFNOR Edition. So we publish books related to management, to standards, and to auditing. Our services can be adapted to any type of organization, independently of its size or scope of work. Next, please. This is to help you understand AFNOR in a deeper way. So when we say AFNOR, we mean 1,250 persons. We mean 14 regional delegations and approximately 40 agencies worldwide. Business ties with over 100 countries, 71,000 customers, and finally 1,800 auditors and evaluators. In the Middle East, we are present since the year 2000. We were represented. In 2012, we have decided to create our subsidiary with the main hub in Beirut, and we are covering the whole Middle East countries, and we have customers in the different countries of the Middle East. And now we're going to start our webinar. Since I'm the moderator of the session, I'm going to kindly ask you to turn off your cameras, turn off your microphones to enhance the quality of the sound. And now let me present Zena Nakat. Zena Nakat is our food safety expert. She is also a team lead auditor according to ISO 22000 and ISO 9001. She has more than 15 years of experience in the US and the region in food safety, mainly in auditing and training. So please enjoy your webinar and welcome Zena Nakat.
Thank you, Stephanie, for the introduction. Thank you, Hospitality News, for this exposure, and thank you everyone for taking the time out of your busy schedule to watch this webinar. We are in the midst of a very unique situation with impacts around the world and across the global food supply chain. In response, and with the goal of sharing our expertise at AFNOR as it relates to this pandemic, we have developed the second webinar in our series targeting the hospitality and food service industry. I hope you find it useful. Restaurants have played an essential role in communities. Beyond just providing food and drink, restaurants fulfill a human need for connection and help shape social relations. The COVID-19 pandemic has changed the way we live and the way we work, but now it's time to talk about reopening. Not every operation will do it exactly in the same way, but there are some basic guidelines that we all need to know. Today's webinar will cover health and personal hygiene, physical distancing, cleaning and sanitizing, and finally, communicating your safe dining commitment. To work safely in the hospitality industry these days, it is essential to know how the virus spreads. So let's get started by debunking some common fears. What's the risk of getting COVID-19 from food products according to control and despite the large scale of the pandemic, the portion of COVID-19 via consumption of food today. Therefore, there is no evidence that food poses a risk to public health in relation to COVID-19. The main mode of transmission for the virus is from person to person, mainly via respiratory droplets that people say. COVID-19 is spreading from person to person, so it's important to sick and stay home. What is the risk of getting COVID-19 from food packaging? The FDA Deputy Commissioner for Food Policy and Response and a great author on food safety culture reassures that even though in experimental settings, COVID-19 was shown to persist for up to 24 hours on cardboard and up to 72 hours on surfaces such as steel and plastics, there is no evidence that contaminated packages which have been exposed to different environmental conditions and temperatures, not necessarily the same as the experiment done above, transmit the infection. Nonetheless, to address concerns that virus present on the skin might be able to transfer to the respiratory system, for example, by touching the face, persons handling packaging should adhere to good hygiene practices, including regular and effective hand washing. Is COVID-19 airborne? The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes, or speaks. These droplets are relatively heavy to hang in the air. They quickly fall on floors or surfaces. You can become infected by breathing in the virus if you are within 1 meter of a person who has COVID-19 or by touching a contaminated surface and then touching your eyes, nose, or mouth before washing your hands. From the previous slides, we can come to the conclusion that it's much more likely that an infected person will spread the virus through person-to-person transmission rather than contaminated food or food packaging material. So COVID-19 is more an issue of occupational safety and controlling employee health, which brings us to this slide. The National Institute for Occupational Safety and Health of the United States defines 5 hierarchies in order to control workplace and occupational hazards. The hierarchy is arranged beginning with the most effective controls, which are on the top, and proceeds to the least effective. In the case of COVID-19, elimination or substitution of the hazard are not possible. So we end up with engineering controls, administrative controls, and personal protective equipments. In most cases, a combination of these three control measures will be necessary to protect workers from exposure to the virus. Engineering controls involve isolating employees from work-related hazards. For example, installing a physical barrier, increasing circulation of outdoor air by opening windows and doors, adding more hand washing stations, and separating people 1 to 2 meters apart. Administrative controls, on the other hand, require action by the worker or employer. Typically, administrative controls are changes in work policy or procedures to reduce or minimize exposure to the hazard. For example, encouraging sick workers to stay home, minimizing contact among workers, training and education, establishing extra shifts that reduce the total number of employees in a facility at a given time are all examples of administrative controls. The least effective control is the use of personal protective equipments, and this should be based on risk assessment. Protection of workers, employee screening. Protecting employees' health is the best way to keep guests safe. Restaurants should consider conducting employee screening while being sensitive about exacerbating fear and anxiety. Employees at risk are those above 65 years of age or those suffering from a chronic illness such as kidney disease, heart disease, hypertension, lung disease, diabetes, or asthma. The level of screening that is appropriate will differ depending on overall spread of the virus, as well as other risk factors. Risk factors such as employee age, the total number of employees in a facility, where do they live, how do they commute to work. Companies can ask employees if they have COVID-19 symptoms. They can also ask them if they have been in close contact with someone with COVID-19 or showing symptoms of COVID-19. Encourage workers to stay home if they are sick, and it's time to review the sick leave policy. Take temperature using a touchless accurate infrared thermometer, noting that fever is only one of the symptoms of COVID-19, and absence of fever alone is not a reliable indicator of wellness. So screening will not necessarily identify individuals who are infected with the virus but are asymptomatic. Special attention should be given to seasonal and temporary workers as well. Employees and personal protective equipments. Personal protective equipments can be an effective tool in reducing the spread of both the cross-infection due to COVID-19 and cross-contamination, which is a food safety issue, within the food service industry, but only if used properly. PPEs should never replace proper personal hygiene and proper hand washing. PPEs can include face masks, gloves, clean uniforms, worn on site and laundered daily. It's time to consider employee lockers or place to store their personal belongings in order to prevent any type of cross-contact. Other PPEs include hairnets and closed non-slip work shoes. Employees and glove usage. According to the WHO, disposable gloves should never be used as a substitute for hand washing. In fact, the COVID-19 virus can contaminate disposable gloves in the same way it gets onto workers' hands. Removal of disposable gloves can lead to contamination of hands. It's very important to demonstrate to your employees the proper donning and doffing of gloves. Always wash hands for at least 20 seconds prior to putting on disposable gloves. And wearing disposable gloves can give a false sense of security and may result in staff not washing hands as frequently as required. So as a conclusion, the old adage remains true. Hand washing is a greater protective barrier to infection than wearing disposable gloves. Employees and mask usage. This is mainly for asymptomatic workers that can spread this respiratory virus with putting on a mask. Wash hands with soap and water. Cover mouth and nose with the mask. Make sure there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do so, wash your hands or use hand sanitizer. Replace the mask with a new one as soon as it gets damp or dirty, and never reuse a single-use mask. When removing the mask, remove it from behind, never touch it from the front, discard it immediately in a closed bin, and wash your hands with soap and water afterwards. Single-use face mask disruption of the global supply chain has enticed the CDC to publish on its website a do-it-yourself cloth mask guidelines. In addition, AFNOR Group, and as a part of supporting societies during this crisis, has developed a free standard in several languages regarding cloth masks that was also adopted by the AFNOR. The FDA recommends that these cloth coverings be provided to employees, changed as frequently as single-use face masks, and laundered with other uniforms or coats, washing with common laundry detergents, hot water, and complete drying at a high temperature setting. Training and education are critical for effective preparedness and response. Restaurants must train their employees on signs and symptoms of COVID-19, how the virus spreads, the risk for workplace exposure, and how workers can protect themselves and guests. They also need to be trained on self-monitoring and reporting illness, cough and sneeze etiquette, coughing in the elbow, proper usage of the personal protective equipments, frequent and proper hand washing practices. In fact, Restaurants Canada recommends washing hands at a minimum every 30 minutes during this pandemic. Use of hand sanitizers when hand washing is not accessible, physical distancing measures, and of course, re-emphasize proper food safety practices. There are plenty of available videos and infographics on the National Restaurant Association Educational Foundation, the FDA, the CDC, and the WHO websites. I highly recommend you to check them out. Hand washing training. Food businesses need to ensure that well-stocked and conveniently located hand washing stations are timed to reconsider and access thorough, at least the 20 seconds through frequent hand washing. Regular soap and warm running water above 38 degrees are adequate for proper hand washing. Hand sanitizers can be used as an additional measure to replace proper hand washing, preferably using a touch-free dispenser. The CDC recommends the usage of an alcohol-based hand sanitizer that contains at least 60% alcohol. 95% alcohol sanitizers are not as effective as 60 or 70% alcohol, as the alcohol is going to evaporate very fast and will not have enough time to penetrate into the virus capsule and destroy its genetic material. Physical distancing. WHO, physical distancing is 1 meter, while the CDC is 2 meters. Physical distancing is very important to help slow the spread of COVID-19. All food businesses should follow physical distancing guidance as far as reasonably possible. Potential for close contact can occur at the back of the house, at the front of the house, in receiving and delivery areas, and in common facility areas such as break rooms, locker rooms, restrooms, hallways, entryways, and waiting areas. Front of house and physical distancing. Using signs and floor markings to help with distancing in the waiting areas, entrances, checkout, restrooms is one of the many measures possible. Other measures can be such as providing directional signage to indicate flow through the restaurant as well as outside, encouraging guests to wait outside or in their cars to be seated, limiting the number of guests to those that can be adequately distanced 1 to 2 meters apart, limiting the size of parties to the current public health authority restrictions, marking certain tables and chairs unavailable for use, adding barriers between booths, such as in the picture in front of you, using smaller tables, and of course, prioritizing outdoor seating as much as possible, especially in this wonderful weather. Front of house and reducing contact. High-touch items such as seating covers, tablecloths, linen napkins, condiments, and reusable menus should be removed from use. Otherwise, appropriately washed and sanitized and changed after each customer or party. Glasses, cutlery, rolls, condiments should be brought only once customers are seated. One suggestion is to pre-roll the utensils in napkins prior to use, of course, by an employee who has recently washed and sanitized his hands prior to the pre-roll. Then these pre-rolled utensils should be stored in a clean container till customers are seated. These pre-rolled utensils are to be put in front of the customer on the table, again by an employee who recently washed his hands. Another alternative is to use disposable utensils, dishes and napkins, tablecloths, and single-use condiment packets. Contact between the wait staff and guests should be limited, and where face coverings are not mandated, consider requiring wait staff with direct customer contact to wear face coverings. Menus and reducing contact. Menus, if laminated, should be cleaned and sanitized after each use or party. Other suggestion: disposable single-use menu, disposable placemats with menu written on them, digital menu display, mobile access to menus, virtual menu powered by a QR code like the slide in front of you is an option. Front of house and self-service. The Centers for Disease Control of the United States recommends discontinuing operations such as salad bars, buffet, and beverage service stations that require customers to use common utensils or dispensers. If self-service is open, however, there should be an attendant available to monitor the buffet. Only clean, unused plates and cups shall be used during refill, and consider putting extended sneeze guards in place. Physical distancing and technology. COVID-19 has forced almost all restaurants who want to serve customers in this time to universally embrace technology if they were not already doing so. The US National Restaurant Association suggests the below: encouraging guests to call or text ahead, considering a reservation-only based model to better space diners, opting for ordering ahead to limit the time spent in the restaurant, touch-free methods of communication such as replacing buzzers with text notification of table availability, automated ordering systems, or contactless payment systems if possible. Otherwise, ask customers and employees to exchange cash or cards by placing them on a receipt tray or on the counter to avoid hand-to-hand contact. Needless to say, staff handling payment should not be the same as the ones handling clean dishes and foods. Now we're going to talk about physical distancing and the back of the house. Stagger workers' arrival and departure times to avoid congregations of workers in parking areas, locker rooms, and near time clocks. Stagger employee shifts when possible. Stagger workstations to avoid employees standing directly opposite one another or next to each other. Limit the number of staff in a food preparation area at any one time to maintain at least a 1 to 2 meter distance between them. Organize staff into working groups or teams to facilitate reduced interaction between groups. This is called cohorting. So in case someone tests positive in one group or cohort, then you can quarantine this group without compromising your whole workforce. Where physical separation is not possible, consider spacing options that include other mitigation efforts such as face coverings with increased frequency of cleaning and sanitizing surfaces. Physical distancing is also very important in break rooms. High standards of public health measures for hand washing and respiratory etiquette need to be maintained in break rooms. Other measures should include no food sharing, maintaining a physical distance of 1 to 2 meters between workers, including in seating arrangements, staggering break times, or providing temporary break areas and restrooms to avoid groups of workers during breaks, a visible notice for staff promoting hand hygiene and physical distancing, and of course, cleaning and disinfection after each break all contact surfaces and high touch points such as tables, microwaves, serving utensils, fridge, and door handles. Now we're going to move to cleaning and sanitizing. Food service establishment may want to consider a more frequent cleaning schedule based on risk, especially in front of house areas. Food services might want to consider also a higher number of staff for cleaning activities. These measures, combined with the fact that food is not known to be a source of transmission, provide assurance on the safety of food production. It is important to minimize tool sharing and to frequently clean and sanitize high-touch surfaces. Suggestions are: create a checklist of all surfaces your staff and guests will come in contact with, sanitize more frequently for items used by multiple people during the shift, look at assigning pens, knives, clipboards, utensils to individuals to minimize multiple person contact, use auto-open doors or encourage bumping doors open with the hip without touching the knobs. Needless to say that staff engaged in environmental cleaning should wear proper personal equipment when performing cleaning activities. Examples of high-touch surfaces in front of the house as per Restaurant Canada are sneeze guards, door handles, dispensers, tablets, switches, chairs, tabletops. High-touch surfaces at the back of the house are taps, utensils, Again, door handles, switches, dispensers, food contact surfaces, and hand contact areas. In the restrooms, high-touch surfaces are door handles, bathroom handles, toilet flush, toilet seats, switches, dispensers, etc. Clean and sanitize restrooms regularly based on frequency of use. Clean and disinfect any counter, table, chair, or hard surface between use. Remember that hot water can be used in place of chemicals to sanitize equipment and utensils in manual ware-washing sinks. Verify that your ware-washing machine is operating at the required wash and rinse temperatures and with the appropriate detergents and sanitizers. Ensure that all non-disposable food service items are handled with gloves and washed and sanitized between use. Make cleaning and sanitizing practices highly visible to your customer. Consider, for example, a disposable card or some sticker or sign that you can put on the table to communicate to your guests your cleaning and sanitizing efforts. What chemicals to be used? The US Environmental Protection Agency has a list of registered disinfectants for use against COVID-19. Within that list are two chemicals common to the hospitality industry: quaternary ammonium and sodium hypochlorite, more commonly known as bleach. Use the list N provided by the EPA to check the EPA registration number on the chemical label. If the registration number matches a product on the disinfectant list, it can be used against COVID-19. It's always important to follow manufacturers' instructions, paying close attention to the contact time, the concentration, and if the product is safe for use on food contact surfaces. I highly urge you to visit the EPA website and the list N of approved COVID-19 disinfectants. Recently, the EPA has added to its website a sentence in red that these chemicals, sanitizer, or disinfectants that are on this list are products for use on surfaces, not humans, not to be sprayed on humans. What about fumigation or wide area spraying to help control COVID-19? The EPA stand on this is that unless the pesticide product label specifically includes disinfection directions for fogging, fumigation, or wide area or electrostatic spraying, EPA does not recommend using these methods to apply disinfectants. EPA has not evaluated the product's safety and efficacy for methods not addressed on the label. One effective measure is the sanitizing. The CDC does not recommend the use of sanitizing tunnels. There is no evidence they are effective in reducing the spread of COVID-19. Chemicals used in sanitizing tunnels could cause skin, eye, or respiratory irritation or damage. Another ineffective measure is this nano steam gun. This nano steam has been created or invented for hair salons to apply hair dyes. The problem with this gun is that it has a heating element. So if any chemical is going to be sprayed out of the nozzle, it's going to be subjected to a high temperature, which is going to break the molecular structure of the chemical, rendering the whole process ineffective. This air ductor, or this kind of clip that you can wear on your shirt, claiming that it contains chlorine dioxide and it helps protect against COVID-19, is also ineffective. It hasn't been tested by the WHO or the EPA or any reliable institution. On top of it, chlorine dioxide is an irritant gas and it is not proven that this method is effective to protect against COVID-19 if worn by the user. Last but not least, communicating your safe dining commitment. As you are reopening, the idea of four walls marketing is imperative. This strategy refers to the physical appearance of your business, the attitude and appearance of your employees, and the type of experience you create for your customers. So it's very important to build trust and proactively communicate these safe dining commitments to your customers. Examples can be post signs advising customers not to enter if symptomatic, post signs reminding guests about physical distancing and thanking them for their patience as you work to ensure their safety, display signs in multiple locations that indicate the maximum number of customers and staff the restaurant can accommodate at any one time, post a description of sanitizing and physical distancing measures taken by your facility, and have hand sanitizer stations available at interest points. Use platforms to communicate with customers, your hours, menu items, reservations, etc., and help promote your physical distancing and safety efforts by updating your website and or including a pop-up on the home page, publishing on all your social media channels, emailing your mailing list, sending text messages, including flyers on all your takeout and delivery orders, posting a notice on your front door, or updating your outgoing voicemail greetings. Now, going to the floor to Stephanie, who will introduce AFNOR label for COVID-19 hygiene measures that can be used to communicate your safe dining commitment to your customers and regain their trust.
Thank you, Zena, for this very interesting presentation and for your positive energy as usual. So last but not least, I'm going to present to you our latest product, which is the Hygiene Measures COVID-19 label. So as Zena was mentioning at the end of the presentation, it is very important now to communicate to your customers regarding the different measures that you have taken. One way to communicate and to reassure your customer that adequate measures and precaution measures were put in place is to display a label, and this label can be delivered by a third party, a totally independent third party. Why the importance of such a label? Because now we all know that there will be no regain of activity without the trust of the stakeholders, particularly the customers. So in order to regain the trust of these customers, one way could be to display a label showing that you have been verified or inspected by a third party, and that the third party approved all the sanitary measures that you have taken and implemented within your organization. This label is going to help you to make certain that your commitment is recognized and enhance the trust of your stakeholders. This is the first and most important thing. Reassure your team about the safety of the workplace, because usually we talk a lot about the customers, but we also need to reassure our employees, our team. Third thing that is also very important is to ensure the verification of all implemented measures by a qualified and independent third party. Of course, being independent is the most important thing in this sentence. And at the end, sustain your actions in terms of health and safety, because now some of the implemented measures will become sustainable and will become part of your usual system. So what is the method in order to obtain this label? So it is an audit. This audit will be organized by auditors from AFNOR. This audit will be done based on a guideline that includes 4 major parts. First part is the preparation. So the preparation of your organization for the reopening. The second part is the do, so the implementation of all these preventive measures, the verification that these preventive measures are put in place and are efficient, and at the end, the updates. Why is it important to update? Because as we all know, we are all students with this COVID-19, and there is new piece of information every day or every week. So we should remain up to date, and we should include any new interesting updates within our system. Of course, I need to mention that this guideline was made based on international references. Some of the criteria that will be audited, your general organization, hygiene measures, communication and training to the team, operational phases, so from the start of the work till the end and the closure of your organization, the storage and the purchasing activities, and all the updates and improvement. So this audit will be done like any other audit. So you have the auditor that will come into your organization, that will talk to the team, that will inspect all the areas, that will check documentation. And during the audit, the guideline will be verified. The guideline includes 100 criteria. And in order to obtain the label, you should have a score of 80% or above of the total criteria that are supposed to be fulfilled. So in case you have the score, you will automatically get this label that you can display in your organization or on your website, and this way your customer will know that you are being audited by a third party and that you have implemented efficient measures. So our slogan for the COVID-19 is to always fight COVID-19 with knowledge, not fear. And now I give the floor to all your questions and answers. Thank you again for attending our webinar.